and thank you for not being bored and giving up on this program. You know, a lot of people watch the whole thing, like finish the whole program over and over, but I'm glad you're one of them. All right, listen. I've got an amazing, literally amazing testimony video for you on this episode. And this is Courtney. And oh my God, Courtney. When she was testing, she said, I'm testing in like 2.5 weeks. And I was like, no way. She was like, yeah. I said, it has been done before, but those are few people who can execute, who have that work ethic, who can like tune in every single day and do like 8 hours, 10 hours, 12 hours a day. Like literally, you cannot finish the whole program in 2 weeks. And she was like, I bet you I can, and I'll prove you wrong, and I'll be one of those who have tremendous work ethic. And I said, all right, let's go. So she joined the program, and oh my God, she proved me wrong. She is a superwoman. And I want you to listen to her testimony and just get inspired a little bit of putting that extra work, that extra mile, because listen, that's what differentiates people who are at this level, the average people, and people who excel. And I bet you are one of them, right? I doubt no one from now on, because I know that you can do it. You just need to tap in, you know, like your inner you, like to your inner potential, because trust me, you never know what you're capable of. All right, let's listen to Courtney. She is amazing. Let's go.
Hello, my name is Courtney. I am creating this video to give you a review of my experience with the Alpha Slices webinar for the NCLEX. So when I first came across the ad for this webinar, it seemed like it was geared towards people who had previously taken the NCLEX and failed. I myself had never taken the NCLEX before, so I felt that this webinar would be a nice, complete, comprehensive review of the material needed, considering the population that it was geared to. In the past, I had read over like Saunders' textbook and even taken some UWorld questions, but I didn't really feel like they helped me that much. I honestly felt like it was information overload, and it was kind of discouraging to feel that way before my NCLEX. I actually graduated nursing school last year in August of 2019. So it had been a couple of months since I had actually touched the material or been aware of it, and I just wanted something that would adequately prepare me for this exam in a way that I knew how to answer the questions and I was able to retain the material needed. So super happy that I came across Mo's NCLEX webinar. He had a live review available as well as a self-paced 4-week course. So since it was April 21st and my NCLEX was scheduled for May 7th, I decided to do the self-paced course. And I tried to reschedule my NCLEX exam so that I could complete the full 4 weeks. However, when I went to reschedule it, the next date available wasn't until September of this year, which was many more months down the line. I decided to just do the webinar courses in a way that would allow me to complete it by my NCLEX date. So instead of doing one NCLEX webinar per day and then just the weekend test over the weekend, I decided to do 2 to 3 webinars per day, depending upon how long they are, because some of them are a little bit longer, and then do the weekend test. And I actually finished the entire webinar series, the full 4-week course, in 2.5 weeks on May 6th, the day before my NCLEX. And I know you are not supposed to study the day before your NCLEX. However, I felt that I was putting myself at a disadvantage if I did not complete the full 4-week course. So I completed all of his webinars by May 6th. I got a good night's rest, and I took my NCLEX on Thursday, May 7th. 2 days later, on May 9th, I got my quick results from Pearson VUE, and I passed. So this webinar is amazing. I know the questions might seem hard at first. You might feel tired. You might wonder if you need to memorize these things. Let me tell you, everything that Mo tells you to do, absolutely 100% do it, because it's going to help you immensely on this exam. I know it's in the middle of the pandemic right now, so the minimum amount of questions was 60. The maximum was 130. My NCLEX actually shut off at 60 questions. So, and I can definitely tell you, the way that Mo tells you how to read over the questions and think about the answers, I followed his advice 100% to the T, and I passed. This webinar is so worth it, guys. Just put in the work, no matter if you're tired or not, and I promise you the results will pay off later. Good luck to all of you guys, and thank you so much, Mo. I cannot thank you enough.
Hey, welcome back. Did you like Courtney? Of course you did. She is adorable. And what I like about Courtney is her work ethic. When she says she's gonna get shit done, and I'm gonna beep that. When she says she's gonna get shit done, she gets it done. Oh my gosh, she's freaking amazing. She reminds me of my little me. No, I'm just kidding. All right, let's kick this episode off and start with the first question. But first, I would like to welcome you to the self-paced virtual trainer, the ultimate algorithm to pass your NCLEX on your very next attempt. And listen, when I say the very next attempt, I literally mean the very next attempt. The next time you're gonna take your NCLEX, trust me, you're gonna be proud of yourself. You're gonna be on this wall of testimonials, the wall of fame. You are no different than anyone on the screen. Oh my God, I can't wait for that moment. I want you to visualize it every single day. Because the road to become an Alpha Slice is not easy. And you need to visualize that and overcome your daily obstacles on a daily basis. Listen, obstacles are gonna be there every day. It's you who controls what to do and how to deal with them. So be ready to have a positive mental attitude and to deal with them on a daily basis. All right, let me welcome you to the Alpha Slice family, because you are family. Let's kick it with the first question. The nurse provides care for an elderly patient with no past medical history. The nurse evaluates the patient's immunization status. Which of the patient's immunizations are up to date? Select all that apply. Listen, so there are two types of vaccination schedules. There is the pediatric and the adult. So in your vault, you'll have both. But I'll have a screenshot of the adult so that we can go over it real quick. So let's read the question again and find keywords. The nurse provides care for an elderly patient with no past medical history. Oh my God, this keyword is very, very, very important. No past medical history. The nurse evaluates the patient's immunization status. Which of the patient's immunizations are up to date? Immunizations is another keyword. Listen, so this question, if I wanted to phrase it real quick in my mind, I would say I've got an elderly patient, no past medical history whatsoever, like no comorbidities, no hypertension, no diabetes, nothing. So a healthy elderly patient. And I want to check if he is on point with his vaccination. Is there anything overdue that he needs to take, or everything is up to date, right? So what I'm going to do right now is select all that apply. I'm going to use the strategy of true or false. So I'm going to start with the first one. Received his tetanus booster at age 60. So all adults should receive tetanus booster every 10 years, or if they get injured, they'll get an extra shot. But it's usually every 10 years. So if this patient received his tetanus booster at age 60, so the next one is due at age 70. So for this one, he's up to date. So the second one is, did not get the hepatitis A vaccine yet. Remember, we said this patient has no past medical history. So people who are due for hepatitis A are people who are at risk. So this patient is not at risk. So I'm gonna eliminate option number 2. So option number 2 is false. 3, last herpes zoster vaccine at age 60. And this is true because adults over the age of 60 should receive herpes zoster vaccine. Option number 4, did not get the hepatitis B vaccine yet. Listen, this is the same as option number 2. Patients who are at risk will receive hepatitis B. If they're not at risk, they'll not receive hepatitis B vaccine, okay? And number 5, got flu shot this season. And this is true because flu shot is given to all adults above the age of 19 on a yearly basis. So the right answers are 1, 3, and 5. And let me give you a quick glimpse on the vaccination schedule for adults. Maybe you see the screenshot a little bit hazy, but again, you have it in your vault. But here on the left hand side, just under the vaccine column, you will see all the vaccines. And then at the top, you've got the age groups where you see them horizontally. So the first vaccine is influenza vaccine. So influenza vaccine is given to everyone on an annual basis. So you pause the video and take a look at all vaccines, but let me point out a couple real quick. For example, MMR, measles, mumps, rubella. You see there, it's given 1 or 2 doses depending on indication. And then it says, if born in 1957 or later. When you check your vault and you see the PDF, you scroll all the way down to the last page and read specifics about every single vaccine, especially if there is a condition. So in this case, if born before 1957, consider 2-dose series MMR at least 4 weeks apart. And then just underneath it, you've got the varicella vaccine. 2 doses if born in 1980 or later. So whoever is born before 1980 is given 2-dose series of varicella. The second dose is usually 4 to 8 weeks later from the first dose. And then for example, just underneath it, you've got zoster recombinant. So when is this vaccine due? Actually, 2 doses are due after the age of 50. Underneath it, zoster live. 1 dose is due at the age of 60 or older. But then you see there is or. So zoster recombinant or zoster live. So the patient needs to take one of the two, not both of them. Let me go down to hepatitis A, hepatitis B, and what it actually says, 2 or 3 doses depending on the vaccine. But it is grayed out, like the dark gray. And there are keys at the bottom. So the dark gray means that it is recommended vaccines for adults with an additional risk factor or another indication. So if you go back to our previous question, the patient has no medical history and had no risk factors. That's why we did not choose hepatitis A and hepatitis B as correct options. Alright, so make sure you familiarize yourself with the vaccination schedule. It's very important. Just know it once and for all. Maybe make a flashcard or type, a few notes into my notes, all right? Let's move to the next question. The nurse provides care for the patient receiving radiation therapy for lung cancer. Which patient statement indicates to the nurse that further intervention is needed due to the side effects of radiation? Select all that apply. So this question should be easy for you because we already discussed radiation therapy in the past, nursing care for radiation therapy, and side effects. So now I'm going to read the question again and let's highlight keywords. The nurse provides care for a patient receiving radiation therapy for lung cancer. So radiation therapy for lung cancer is one of the keywords. Which patient statement indicates to the nurse that further intervention is needed due to the side effects of radiation? So I'm looking for side effects. It's my other keyword. So now if I want to rephrase this question in my head, this is how I would do it. First, I would visualize myself. Remember that picture where we saw radiation therapy, that big CT scan machine? So I would visualize myself in that room. Visualize the patient. So he's a lung cancer patient. Usually there are marks on the chest where the cancer is and I'm going to give the radiation to, right? So this is how I visualize myself. The patient is sitting there and he has lung cancer. Now he's complaining of side effects. What are those side effects that I need to pay attention to? Now I'll go read the options and figure out which side effects are needed attention and need intervention. So let's see. I'm having difficulty swallowing. Is this a side effect of radiation therapy? I need to think about it. If I'm receiving radiation to the chest, surrounding tissue could be affected. So this area could have some inflammation, some swelling, and it's causing the patient to have difficulty swallowing, which might result in malnutrition. So of course, I need to pay attention to this option. This is a side effect that needs intervention. So number 1, yes, I'm gonna keep it. Number 2, I'm missing days at work recently. So this option indicates fatigue. Listen, with radiation therapy, you are going to have fatigue. But you need to pay attention to it, especially when fatigue interferes with your daily activities. For example, in this option, the patient is missing days at work. So yes, it's interfering with his daily activities, and I need to pay attention to it. So yes, I'm gonna keep that option. Option number 3, I didn't have a bowel movement in 4 days. And I intentionally put that option in here because this sometimes confuses my students. And I know it does. Because sometimes they mix up when they see cancer patients, like they combine all side effects, like chemotherapy, radiation therapy, this and that. You should not. So in this case, having constipation is not a side effect of radiation therapy. I mean, if radiation therapy was to the abdomen, then maybe. But in the case of radiation therapy to the abdomen, you would see diarrhea more than constipation. But in this case, it's a lung cancer and radiation therapy to the lungs, then constipation is not an effect. And the second thing that I wanted to tell you is, in this case, to consider constipation as a side effect that requires intervention, it needs to be 5 days or more. So I'm gonna eliminate this option just for the fact that this is related to chemotherapy and not radiation therapy. Option number 4, I have rash on my armpits. Remember, rash is one of the most important side effects of radiation therapy, especially under the armpits, because patients put deodorant under the armpits, and then with radiation therapy, it interacts and they will get severe rash. So please make sure that you educate your patient not to put any deodorant or any lotion of any kind during radiation therapy, and then you have to detect it, check it, assess the patients on a daily basis when they come to radiation. Option number 5, my hair is falling out in clumps. Listen, again, just like option number 3 with the constipation. Alopecia or hair loss is related to chemotherapy and not radiation therapy. But in case the radiation was to the brain because of brain tumor, then that would be a valid option. In this case, I'm gonna eliminate it. So the right options are 1, 2, and 4.
Hey, episode number 8. Oh my God. Listen, I'm going to take a quick break because I want to deliver a very important message to you. Listen, you've watched 8 episodes so far. I know from myself, if I'm watching a Netflix special and I've been binging those episodes, at episode number 8, guess what? I'm gonna call my friends and tell them, hey, you need to watch this because it is amazing. And if you are getting value from this course and you are loving it, please tell your friends about it. Anyone who refers a friend and they successfully signs up, guess what? I'm gonna send you a referral fee. All you have to do is send me a message on Instagram, tell me who's your friend, what's your full name, what's your address, and I'm gonna send you a referral fee because you mean the world to us. You are a true alpha slicer because you are spreading the word. Listen, now, this message is gone. I hope it resonates with you. Now, let me ask you a quick question. I just want to make sure that you are retaining information. And this question is going to be about the vaccination schedule. Yes, it is very important. And if you did not memorize the vaccination schedule yet and you just passed by it, listen, it's in your vault. Go ahead, download it, and you need to memorize it, all right? Pediatrics and adults. But I've got a question about the adult vaccination schedule. Listen, when do you give the zoster live vaccine? Is it between 40 and 50, 50 and 60, or above 60 of age? Yes, you are 100% correct. It is above 60 of age and you only need to take 1 dose. So I'm glad that you have memorized and mastered the vaccination schedule. Let's go ahead and move on with the episode.
Right, now we're going to talk about some hypertension medication. A patient who takes medication for hypertension complains of a dry cough. Which medication will the nurse suspect is causing the cough? I'm going to read it again and pick up keywords. A patient who takes medication for hypertension, so hypertension is a keyword, complains of a dry cough. Again, signs and symptoms are keywords, so dry cough is a keyword. Which medication will the nurse suspect is causing the cough? Alright, so if I want to rephrase this question is pretty easy. I have a hypertension patient and he's receiving antihypertensive medication. Now, he's having a side effect, which is dry cough. Which of those 4 medications is causing the dry cough? There's one family in the antihypertensive medication that causes dry cough. Like, it is a hallmark for that class to cause dry cough. Which one is that? We're going to learn more about it, but let's read the medication and the options. Amlodipine, lisinopril, verapamil, and propranolol. Listen, I know you're not an expert when it comes to drugs and medication, especially for the NCLEX. That's totally fine. Guess what? You and 99% 99.99% of my students, the first question they ask, hey Mo, do you have like a PDF or like a template or a list for medication that I need to memorize for the NCLEX? Guess what? Yes. And this is a common problem. So I'm not gonna try to guess you, but I'm just gonna go over this question and then I'm gonna move to slides where I'm gonna discuss medication. So every time we discuss medication, boom, afterwards you're gonna have a slides, we're gonna talk about indications, side effects, and patient teaching. Those are the very important things that you need to know for your NCLEX, right? Don't worry about interactions and contraindications much. What you need to focus on are indication, side effects, and patient teaching, okay? So in this question, the first option is amlodipine, which is a calcium channel blocker. Calcium channel blocker do not have a side effect of dry cough or non-productive cough. Verapamil, which is option number 3, the same thing. It's a calcium channel blocker. Option number 4 is propranolol, which is beta blocker. Again, beta blockers do not have a side effect of dry cough. Which antihypertensive class has a dry cough side effect? You're not gonna guess it, but it's ACE inhibitors, angiotensin converting enzymes inhibitors. The hallmark sign of this antihypertensive class is dry or non-productive cough. All right, so let's read the rationale real quick, you and me. Lisinopril is an ACE inhibitor. One of the most common side effects is a non-productive cough. All right, now let's move to some slides and talk about some antihypertensive drugs. And the first class we're going to start with are alpha adrenergic blockers. Those are very rare to see on your NCLEX, but I mean, you can see them. That's why we have them on the slide. So the most important drugs that are included in this class are prazosin and doxazosin. You can see that I highlighted the suffix in red, zosin. All right, now what's the indication for alpha adrenergic blockers? They are used as peripheral vasodilator that acts directly on the blood vessels, and they are also used in cases of extreme hypertension of pheochromocytoma. Pheochromocytoma is a hormone-secreting tumor that occurs on the adrenal glands or inside the adrenal glands. The adrenal glands are this small gland that's on the top of the kidneys, okay? So side effects for alpha adrenergic blockers, you've got orthostatic hypotension, you've got weakness and palpitation. Now the nursing care or patient teaching for this class is to warn patients of possible drowsiness, lack of energy, and weakness. Now, a very popular antihypertensive class is beta blockers. Some of the medication that you're gonna see in the beta blocker family are metoprolol, propranolol, atenolol, and bisoprolol. The indication for beta blockers are, it blocks the sympathetic nervous system, especially to the heart. The sympathetic nervous system releases hormones called catecholamines. Those are epinephrines and norepinephrines. They accelerate the heart. So beta blockers, they block this effect and they slows down the heart. Another indication is it produces a slower heart rate. It lowers blood pressure. It reduces oxygen consumption during myocardial injury. The side effects of those drugs are bradycardia, fatigue, insomnia, bizarre dreams, sexual dysfunction, hypertriglyceridemia, which means high triglyceride in the blood, decreased HDL. HDL is the good cholesterol, depression, and bronchospasm. Some of the nursing care and patient teaching for this drug class is check apical and radial pulse daily. And when we talk about apical pulse, is literally grabbing your stethoscope and listening to your heart for a whole 1 minute. And you do the same thing with the Goxin. And the radial pulse is just checking your radial pulse. Monitor for gastrointestinal distress. Do not discontinue abruptly. You also tell the patient to watch for shortness of breath and make sure you give beta blockers cautiously with patients at risk for bronchospasm. Always take at the same time every single day. Beta blockers may mask symptoms of hypoglycemic reaction like tachycardia, for example. And lastly, beta blockers are contraindicated in asthma. Other antihypertensive drugs that we have are angiotensin II receptor antagonists. They also call them ARBs. Drugs under this class are losartan, valsartan, candesartan, and telmisartan. The indication for this drug class is those drugs block the vasoconstrictor and aldosterone producing effect of angiotensin II, especially on vascular smooth muscle and adrenal glands. Some of the side effects are hypotension, fatigue, They might cause hepatitis, renal failure, and hyperkalemia. Some of the nursing care and patient teaching is to monitor liver enzymes and electrolytes. You need to pay attention for that potassium, and of course for the creatinine and liver enzymes. You also monitor for angioedema in those who have history of angioedema, especially if they were on ACE inhibitors previously. Angioedema is an area of swelling in the lower skin layers or in the mucous membranes. It can happen everywhere, like in the face, in the larynx, in the abdomen, in the arms, in the legs. So pay attention to that. The other drug class is angiotensin converting enzyme, or they call them ACE inhibitors. Those are captopril, enalapril, lisinopril, and quinapril. Those drugs decrease blood pressure by suppressing renin-angiotensin-aldosterone system. So ACE inhibitors, they suppress the renin-angiotensin-aldosterone system in the body, and then they prevent the conversion of angiotensin 1 to angiotensin 2. But here's a little bit of background of the pathophysiology. How does it happen? When you understand this, it's easy for you to know how antihypertensives works. So when blood pressure drops in the body, the kidneys release something called renin. Renin, when it swims in the blood, renin alone, it's very hard to increase blood pressure. But then the liver senses that there's renin in the blood. So what it does, it converts the inactive angiotensin into angiotensin 1. Now, angiotensin 1 has a little bit of effect on blood pressure, but it's not massive. But when you have angiotensin 1 in the blood, what happens is ACE inhibitor, or the ACE converting enzyme, they convert angiotensin 1 into angiotensin 2 in the lungs. And that will have a huge spike of blood pressure. But another effect of angiotensin 2 is it affects aldosterone. And aldosterone works on the kidneys. If you remember, aldosterone is the gatekeeper. So it increases salt and fluid in the blood. And that increase in fluid will increase the blood pressure. So that's how the renin-angiotensin aldosterone system works. So I hope that benefits a little bit. If you need to rewind back and listen to the explanation again, please do. But now let's talk about another indication where ACE inhibitors is also useful with patients diagnosed with diabetes. Side effects are proteinuria, neutropenia, skin rash, and dry cough. Some patient teaching and nursing care are observe for acute renal failure, and then you've got to do routine renal function tests. Now, another very popular class of antihypertensives is calcium channel blockers. The drugs under this class are diltiazem, nifedipine, verapamil, nicardipine, and amlodipine. Those work on hypertension, on supraventricular arrhythmias, on angina pectoris, on migraines, and cluster headaches. Side effects are hypotension, dizziness, edema, nausea, constipation, tachycardia, and heart failure. Some of the nursing care or patient teaching are check blood pressure and pulse periodically. And listen, there's a little bit of confusion when we teach the patient to check blood pressure periodically. I mean, when the patient is at home, they don't have to check blood pressure before every single dose of medication. They are not in a hospital setting. I mean, if you are in a hospital setting, yes, it is the job description. It is under her scope of practice for the nurse to check blood pressure with every single medication that she gives, if it's an antihypertensive medication, or if a medication that affects blood pressure. But if the patient is at home, they don't do that. So once a week is fairly enough, and it's called checking blood pressure periodically. So it could be once a week, or once every day, or once every 2 days, or every other day. But that's what we mean by periodically. It's not with every dose. I just wanted to make this clear. Limit caffeine consumption, take medication before meals, avoid grapefruit juice. Actually, grapefruit juice increases the serum levels of calcium channel blockers in the blood, and that might cause severe hypertension. And lastly, avoid high-fat meals. High-fat meals also increase the serum level of calcium channel blockers in the blood, and that might also cause hypotension. Now, let's move to the next question. During a patient education seminar about colorectal cancer, which patient does the nurse identify as being at higher risk for colorectal cancer? Right, let's read the question again and highlight keywords. During a patient education seminar about colorectal cancer Colorectal cancer is one of the keywords. Which patient does the nurse identify as being at higher risk for colorectal cancer? Higher risk is another keyword. So now if I want to rephrase the question in my own words, I would imagine the setting, okay? The nurse is giving a seminar. It could be like a community clinic or outside clinic or out in the community. It doesn't matter. So I just visualize that, and she's talking about colorectal cancer. So she wants to identify or give examples. Who are the patients at high risk for colorectal cancer? All right? So let's read the options. The first option is a 20-year-old patient who exercises regularly. Listen, there's nothing suspicious about this option. I mean, a healthy 20-year-old who exercises regularly. Is this patient at risk for colorectal cancer? I don't think so. I'm not trying to treat it as true or false, but when there's a dumb option in the answers, I literally pointed out from the get-go. Option number 2. A 56-year-old patient who follows a high-fat diet. I mean, of course, any patient who follows a high-fat diet is at risk for colorectal cancer. And not just that, but again, any other cardiac diseases, right? Like atherosclerosis, arterial coronary artery disease, congestive heart failure, high cholesterol, high triglyceride, all those kind of, diseases. Option number 3, a 32-year adult who has an uncle with colon cancer. I mean, listen, familial history is a huge risk factor for colorectal cancer, but it's only related or only applicable to first-degree relatives. That means like parents, siblings, or children. But uncles are not first-degree relatives. So I'm gonna eliminate option number 3. And then you've got the fourth option, a 45-year-old female who had hysterectomy 2 years ago. A patient who had cancer in the uterus before and removed it is not at risk for colorectal cancer. It's just not. Okay, if you had a cancer before, you're not at risk for colorectal cancer. I mean, there are certain diseases like chronic inflammatory bowel syndrome or bowel disease. Those patients are at risk for colorectal cancer, but not a patient who had cancer in the uterus before. So I'm gonna eliminate this option. I guess the right option is number 2, a 56-year-old patient who follows a high-fat diet. So in this case, the patient has 2 risk factors actually. Number 1, his age is above 50 years old, and then he follows a high-fat diet. Now let's talk a little bit about colorectal cancer. Cancer of the colon is the 4th most common cancer in the United States. The highest incidence occurs in people older than 50 years of age. Prevention is following a diet of high fiber, low fat food, including cruciferous vegetables. Those may be a factor in prevention of colon cancer. And now you're gonna look at me and say, hey Mo, cruciferous vegetables? What in the hell is this? Yes, I've seen that on an NCLEX question and it blew my mind away. But those are like broccoli, Brussels, cauliflower, cabbage, kale, radish, stuff like that. So make sure you look it up, Google it, but that's what cruciferous vegetables means. So you've got to eat more cruciferous vegetables and increase your fiber intake and maintain average body weight. Don't be fat and eat less animal fat. Now, early detection for colorectal cancer is through a digital rectal examination every year after the year of 40. Occult blood in stool every year after the age of 50, and then a colonoscopy every 5 years after 50 years of age for those who are at risk, meaning those who have risk factors. So the treatment for colorectal cancer is surgical removal, then chemotherapy and radiation therapy. Carcinoembryonic antigen, or it's well known as CEA serum level, is used to evaluate effectiveness of chemotherapy. So usually it is used as a tumor marker. When you diagnose a patient with colorectal cancer, the CEA level is extremely high. And then after they receive chemotherapy, you start monitoring the CEA level. And if it starts dropping, that means that the chemotherapy is effective. This is a picture that shows a colorectal cancer. All right, the nurse assesses a patient diagnosed with a colorectal cancer. What symptoms does the nurse ask the patient during admission assessment? Select all that apply. So this is a SATA question, all right? Listen, I love SATA question. Now, I think think you started picking up the habit of how to answer that question, and it's gonna become a game. You're gonna love them. The more you practice them, the more you feel that the magic is flowing. So let's read the question again and highlight keywords. The nurse assesses a patient diagnosed with colorectal cancer. So colorectal cancer is a keyword. What symptoms, so the question is asking about the symptoms, does the nurse ask the patient during admission assessment? So symptoms is a keyword, and then admission assessment is another keyword. So if I want to rephrase this question in my own words, this is how I would visualize it. This is a colorectal cancer patient. He's being admitted. So I'm visualizing myself in a cancer center. So the patient got admitted, and I need to ask him questions related to some symptoms that typically colorectal cancer patients have. So I'm gonna ask him list of symptoms related to colorectal cancer and see which ones he has. So what are the questions I'm gonna ask? Let's read the option. I'm gonna treat it as true or false because this is a SATA question. All right, number one, instant abdominal bloating. Listen, instant abdominal bloating is not a sign for colorectal cancer. It's usually a sign for obstruction. And another word for bloatedness is satiety. Have you heard of it? If not, you need to. Right? Medical terminology is very important. Satiety. It's S-A-T-I-E-T-Y. Satiety, which means bloatedness. All right? So I'm going to cancel option number one. And option number two is severe spasmodic abdominal pain. Usually patients with colon cancer, especially those who have cancer on the right colon, they might experience colics, abdominal cramps very severely. But those on the left colon will not have those symptoms. So when we say colorectal cancer, where is that? Is it on the right or is it on the left? It's on the left. It's a colorectal cancer. It's on the left. So, and remember, colon cancer is different from colorectal cancer because of the area, right? So this option is wrong in this case, but in general, right colon will have colics and abdominal cramping, okay? So I'm not gonna choose this option. Option number three, ribbon-like stools. Yes, this is a symptom of colorectal cancer. Then you've got rectal bleeding, of course, is a symptom of colorectal cancer. And lastly, diarrhea and or constipation is a symptom of colorectal cancer. So the right options are 3, 4, and 5. A patient with beta cell leukemia is getting high-dose methotrexate. So methotrexate is a chemotherapy. Which statement by the patient shows understanding of appropriate precaution? So I'm going to read the question again and highlight keywords. Remember, most of the times when I have a disease, it is a keyword, and if I have a drug, it's another keyword. And most of the times when I have signs and symptoms, those are keywords as well. So in this case, a patient with beta cell leukemia, so beta cell leukemia is a keyword, is getting high-dose methotrexate. So high-dose methotrexate is another keyword. So which statement by the patient shows understanding of appropriate precaution? Select all that apply. So here I've got a leukemia patient who's receiving high-dose methotrexate, right? You don't need to understand like side effects of certain chemotherapy drugs, but chemotherapy in general, you need to know the side effects of chemotherapy, which we talked about before. So I've got a leukemia patient and he is receiving treatment, high-dose methotrexate. So what are the things that the patient gonna say that indicate that the patient has proper teaching? So now I'm gonna read the options. This is a select all that apply question, so I'm gonna treat them as true or false, all right? So I'm gonna read the first one. Brushing and flossing my teeth twice a day is very important. Listen, patients who are receiving chemotherapy, usually we tell them, even though hygiene is very important, but we tell them not to brush their teeth with a hard toothbrush. We ask them maybe a sponge or a very, very, very soft toothbrush, and then never floss their teeth. Because flossing the teeth might cause bleeding, especially because the gingiva, which is the gums of the patient, are very, very tender, and with thrombocytopenia, which is low platelets, or myelosuppression in general, which is the suppression of the bone marrow. You know, the bone marrow has all the cells that are responsible for immunity and whatsoever. So if those are suppressed, if the counts are low, if you floss, you will have a high tendency for bleeding. So we tell patients not to flush. So I'm not gonna choose this option. The second option is visitors to my room should not bring in flowers. And this is correct information because flowers and potted plants, they are a medium for bacterial growth, especially with patients who are on high dose chemotherapy. They are at risk for, having low immunity and getting infection. So definitely we tell visitors not to bring any live flowers or plants into the patient room. I will bring my own pillow and blanket from home because I can't sleep without them. Again, usually we tell patients not to bring anything from home, especially if they are going to be inpatient or they are going to receive high-dose chemotherapy. Usually high-dose chemotherapy is 5 days, it's inpatient setting for 5 days. So you tell patients not to bring anything from home. We will provide everything in the hospital because we don't want them to bring any bacteria from home. So I'm gonna eliminate this option. Number 4, I will only shave with my personal electric razor. And this is true because of the risk of bleeding. We tell patients not to use a blade, just use a razor. And number 5, I will only allow visitors who have cold into my room if they wear a mask. Never, 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 never. Any patient who has signs of flu or infection are not supposed to come into the hospital in general. So what about coming into a patient who is immunosuppressed or at risk for getting infection? Definitely not. Stay away from the hospital. So the right options are option number 2 and 4. The nurse provides care for a patient diagnosed with esophageal cancer. Which goal does the nurse establish in the plan of care? So I'm gonna look for keywords here. The nurse provides care for a patient diagnosed with esophageal cancer. Listen, esophageal cancer is a keyword. Which goal does the nurse establish in the plan of care? Again, I'm looking for goals. So this is pretty basic. There's no need to rephrase the question. It's direct to the point. So I'm looking for goals. Option number 1, patient will be in complete remission of his cancer. Listen, patient being in complete remission for his cancer, I mean, yes, we would love it every single day. But is that controlled by the nurse? Is that a goal for the nurse? This is a medical diagnosis. This is a medical goal for the provider, for the doctor. They are aiming towards complete remission, but not for the nurse, all right? So the nurse have different goals, and let's read through the options and see what are the nurse's goals. But this is a medical diagnosis, it's not related to nursing. So the second option is patient will be able to eat without aspirating. Yes, this is a goal for the nurse to put on her plan of care to establish during her shift. Just make sure that the patient is able to eat without aspirating. Okay, so I'm gonna choose this option. Option number 3, patient's pain will be controlled. Again, yes, it is a nursing goal to put on the plan of care. I come in the morning, I come in the morning, it's 2 in. I come in the morning, and I want to make sure I put goals and make sure that I will be achieving them during the day. So controlling my patient's pain during my shift is one of my goals. Number 4, patient will maintain his baseline weight. Yes, since this patient has esophageal cancer and is at risk for malnutrition, so I want to make sure that this patient is eating just fine and he's maintaining his weight during my shift, from the previous shift to the later shift. Just make sure that he's eating well and maintaining his weight. So I'm gonna keep this option. And the last option is the patient will consider hospice care. No, this should not be a goal for the nurse during her shift. To put a goal for the patient to consider hospice care is not something that the nurse does. I mean, if it was education about hospice care, yes, I would understand that. But there's no indication in the question that the patient is gonna die in the next 6 months or so, like he has a poor prognosis, and the patient should have the autonomy to decide if he's gonna go on hospice care or not. And then lastly, the provider explains hospice care to a patient to help him consider hospice care, right? So this is not a goal for the nurse to work on. So I'm gonna eliminate that. So the right answers are 2, 3, and 4. But now I'll take this opportunity to talk to you about hospice care and what's the definition of hospice care. Hospice care is designed to give supportive care to people in the final phase of a terminal illness and focus on comfort and quality of life rather than the cure. The goal is to enable patients to be comfortable and free of pain so that they live each day as fully as possible. And usually Medicare approves hospice care if the patient had a poor prognosis and the doctor says that this patient has less than 6 months to live. Now the question is, what if those 6 months passed and the patient did not die? Yes, you can renew hospice care as long as the physician says that this patient has less than 6 months of life expectancy. Now, a very popular question that my students ask, hey Mo, I hear a lot about palliative care. So what's the difference between hospice care and palliative care? All right, let's read a quick definition about palliative care. It is specialized medical care for people living with a serious illness. So when we say serious illness, it doesn't have to be cancer. It could be something else like COPD, congestive heart failure, maybe Alzheimer, Parkinson, ALS, kidney disease. It could be anything, any serious illness. This type of care is focused on providing relief from symptoms and stress of the illness. The goal is to improve quality of life for both the patient and the family. So those patients could be cured, their prognosis could be good, they don't have a life expectancy of 6 months or less. So those patients can choose palliative care and take care of their symptoms like nausea. They do not have to be nauseous all the time. So I put them on palliative care, and there's a team who monitors those signs and symptoms like nausea, pain, difficulty breathing, and so on and so forth, all right? Hey, and this brings us to the last slide of this episode. And you know, that's my favorite slide, the quote for this episode. The quote that I chose for this episode is, I do not make excuses, I make results. And oh my God, I know this should hit home with you. Listen. You're not someone who makes excuses. If you're not logging in every day and you're saying, hey, I've got this, I work 12-hour shift, I've got my kids, I don't have a babysitter, I have to do this for my husband, I have a business, I have a side hustle, whatever the case might be, if you're giving yourself excuses not to log in every day, oh my God, I wish I can grab you from the monitor and slap your face. No, I'm just kidding with you. I'm not harassing you, but I'm just saying. Listen, this is virtual. I'm not harassing. But listen, if you are making excuses and you're saying, hey, I didn't log in today because I didn't have a babysitter, my kids were awake, my kids were sick, I had a 12-hour shift, I was working 3 days in a row, whatever the case might be, do not make excuses. Just make it happen and log in every day. Consume the content. Take notes. Follow what I say to the T. Review day in and day out. Do not make excuses. I want you to make results. And this is how you make results. By tuning in every single day and getting your daily dose of Alpha Slice. Love you, face. See you in the next episode.
Alright, listen, I hope you are enjoying these episodes, and I hope you don't think that I'm so loud by the end of those sessions. I get so enthusiastic, and I guess I explained myself. Let's go ahead. I want to ask you a quick question before we move on, because I want to test your knowledge. I just want to make sure that you are retaining the information, alright? Let me ask you this. Did you refer your friends? Yes or no? No, I'm just kidding. This is not the question. All right, I'm gonna ask you a question about hypertension medication. All right, medication are very, very important on your NCLEX, so you need to memorize those. Listen, what you need to memorize about medication, and I give you those slides. You need to memorize the indication of the medication. Then you've got side effects and patient teaching. Right? Name of the drug, indication, side effects, and patient teaching. Make sure you memorize those. So I'm gonna ask you a question about verapamil. Right, verapamil. What is the indication of verapamil? Is it block angiotensin II, migraines and cluster headaches, pheochromocytoma, or it blocks the sympathetic nervous system? What do you think? Yes, you are 100% correct. Verapamil is a calcium channel blocker, and one of its indication is migraines and cluster headaches. I'm glad you got this right.